Morning mga kabayan. I'm Steven.
And I'm Abby, and we're from Kabayan Remit.
Yeah, and today we have a special guest with us. She is the first person in the entire world to administer the vaccine and the matron for the UHCW, Mrs. May Parsons. How are you,
Hello.
May?
Relaxed. I'm off today, so I'll be back to work tomorrow. Pero at the moment, I'm all right. Thank you. You?
That's good. That's good.
Good.
Yeah, we're well, thank you. So I just wanted to ask, kasi we have a lot of viewers here who wants ba talaga si May Parsons. So who is May Parsons?
So I am just May Parsons, really. So I was born and lived in Pasay City in Manila. I grew up there. I had my high school diploma in Jose Abad Santos High School, which was a part of Aurelia University, the one in Taft. I did my nursing degree in UST College of Nursing, and
Wow,
Tomatin's roar.
Yeah.
And I got my PRC license before I was 20. So I was 19 years old when I got my PRC license. I went to the UK in 2003, October, and I was with about 44 other Filipinos. We were the second batch to arrive in my hospital. And I think there was a third batch that came in February 2004 as well. So there's a very big Filipino community in Coventry.
Wow.
And that's it.
So,
Yeah.
well,
Yeah,
that's
you've been
great.
in the UK for a long time. Yeah,
Yes.
so you've been in the UK for a long time. Did you just stay in Coventry the whole time that you were here?
So I'm here now for 17 years. When we dropped in Coventry. I live currently in Rugby, which is the neighboring rural area. But I lived in Coventry for until 2011. That's 8 years. So yeah, but I've never actually moved any hospitals. So I've always worked in UHCW. The only thing as well is that I haven't really thought about moving anywhere else. I was happy where I was, so yeah, I stayed there for up to now, really.
Yeah.
But well, if you don't mind us asking, what challenges did you encounter when you first came over the UK?
So first of all, when I arrived, it was October 2003. So that was the start of the winter. As you can imagine, it was very, very hot where we come from, and it's like normal is 32, 33 degrees Celsius. In here, I was, I think when we dropped, it was about maybe 8 degrees, 9 degrees for British people. That's kind of like, oh, that's a nice weather. But for me, it's the cold. First of all, was the homesickness. The homesickness, I think, was the most terrible thing to have to experience. But because I was with 44 other people from the same country that relates to where I come from, there was a sense of belonging anyway. So when we first arrived, we were put into a housing facility for nurses. So para siyang boarding house. So we were all there together for at least 3 months. We were given 3 months time to actually find our own housing. We were supported in terms of getting your mobile phone, to contact your family back home. So we were really looked after. The homesickness, I would say, is the most difficult thing to overcome. And I think you have to find very quickly a support network around you to help you deal with that. I think for me it was easier because I had a lot of Filipinos around for 3 months at least, and then I also have my mom, who was working in Dubai at that time. So she was obviously supporting me in terms of phone calls. I cannot remember how much money I've had to spend to go back home at that time. The cold, you get used to the cold. I think it's getting acclimatized with the British weather. It's not so much. I would say it's the family, it's the home, the homesickness, and the fact that there's 8 hours gap between you and your family, and you have to schedule it really well. That was the other thing that I had to struggle with was the language barrier. So even though we're good at English and we're, the form of instruction in the Philippines is in English, it's still different because of the accent.
Yeah.
There's a lot of Scottish people that I worked with. I have a really, really good friend. She's very Scottish with her accent, and I was
Mhm.
also, what? And that,
I think that's a struggle that most Filipinos encounter when they come here.
Yeah.
and I think that comes in time. So don't
Mm.
don't worry if you don't understand it. What my friend said was that it comes to a point where they find it offensive to ask
Yeah.
all the
Mhm.
time
Yeah,
repeatedly.
exactly.
So at the beginning, when I couldn't understand it, I just go, "Oh yes," that's you ask your colleague and go, "What did she say?" That kind of thing. But, I think it comes with practice. Sometimes if you ask the people to speak slower, that was what the problem was before. That was the instructions that the
Mhm.
advice we were given before. If you're struggling to understand the accent and you're finding it hard to understand what they're telling you, you can ask them to say, "Oh, say that again, please, but just slowly because I'm struggling." They don't mind that so much, and I think
Mm.
that's where you kind of come with like the honesty as well. If you
Yeah,
tell
that's true.
them that actually I'm struggling to understand you, could you speak to me kind of slower, and then they will, and they're more than happy to kind of assist you in that way. Also, I met my husband here, so
Mhm.
that helps with the homesickness, obviously, in the feel of belonging. At that time, obviously, we were not in lockdown. There were a lot of Filipino parties, get to know parties,
Yeah.
so
Mhm.
attend as much as you can if you're allowed. Obviously, in this certain climate, it's not. Pero there are virtual parties out there. There are Filipino networks in the wards that you work in. So when I came here, I was in theaters, so I was a scrub
Mm.
nurse, and it's such a big department. There's such a big population of Filipinos out there, so there's always someone to speak to. And with us, we make the connections, we find
True.
friends.
True.
So what I would say with our kababayans is that if they are struggling, please do let someone know. If you're feeling alone and lonely, there's a difference with being alone and lonely. Reach
Mhm.
out, because I'm pretty sure the people that's been here before you would understand where you've come from, what you're experiencing at the moment. And and I think I could say this for most of the Filipinos, if you ask for help, they
Mhm.
were more than happy to help you. Because at the minute, I think it's people cannot, kumbaga, they can't guess what you're feeling unless you tell them. It's the same for everyone. If I don't say to my husband that I'm struggling, he wouldn't know,
Mhm.
because we just
Mhm.
continuously do what we do in terms of our jobs, in terms of the demands for us. We just carry on and do it. Pero unless you say to someone, actually, I need help, I need a hand to hold, I need someone to speak to, they wouldn't know. So what I would advise our colleagues and our kababayans are, if they're struggling, please do connect, please do reach out. There's always someone who would listen. Kahit wala akong time, I will listen, I promise. I'll make the time. So
Yeah.
yeah,
Yeah,
that's
that is a really good advice, to be honest.
good.
Definitely.
Like I said, if people don't say, if they don't tell you that they're struggling, no one would know. And the last thing we want to be reading in the news is that, oh, this, our kababayan is struggling and no one to speak to. Please do reach out. There's always people to help.
Yeah. Just
Mhm.
I guess people just need to learn how to take that first step and
Of course.
admit na I'm feeling really homesick. Parang
Yeah.
ganun lang. And I can see naman din sa Facebook, maraming groups tayo. Like the FCA, or
FNA.
rather FNA rather. There's
Mhm.
also the Filipino community in the UK. There's a
Yeah.
lot of Facebook groups that you can reach out to if you're feeling homesick, diba?
Even our neighbors. I have Filipino neighbors
Exactly.
as well. So
Yeah,
it's really, I think we're expanding in terms of numbers. So
yeah,
in rural areas, I have friends that has moved to a rural area where he was the only Filipino guy there. So I can imagine how difficult it must have been for him. But I think it's the fact that if you say to someone, even if they're abroad, or even if there's, I don't know, 6 hours
Mhm.
time difference or 8 hours time difference, it's the first step is for us to take the, oh, namimiss ko kayo, please talk to me, that kind of thing.
Yeah,
So yeah.
yeah.
Definitely. By the way, our viewers are, I'm pretty sure, is dying to know how were you chosen as the first person? You didn't know them before, diba, that you would be the
No.
first person in the entire world to administer the vaccine. How were you chosen for that role?
So, bale, dun sa trust namin, in the hospital that I work in, we have a program called Peer
Mm.
Vaccinator. But because in the UK we have the winter season, the flu, the influenza, ano ba sa Tagalog yung flu?
Trangkaso.
Trangkaso, yes, that's
Yeah.
it. So there's a lot of history in terms of the effect of flu to everyone in the UK, including the younger people with medical history in terms of their respiratory history, elderly people. As you know, we have a lot of population. We have a big population of elderly people in the UK as well. So during the winter times, we advocate the flu vaccination. So in terms of the patients, they get their letters from their GP saying, here, get your flu vaccination. And our Department of Health here, they recognize what flu strain we have every year. So we have different ones that we use. So sa aming trust, so we have a peer vaccination program where we train our nurses, our allied health professionals to give the vaccines out to our colleagues. So in the health system in the UK, they give it to the people that are actually allowed to get the flu vaccine for free in terms of their age, their medical backgrounds and things. Pero sa hospital namin, and I'm pretty sure all of the NHS hospitals, they provide the flu vaccination for their staff. So even if you don't get to that criteria for the government, for if you're a public, if you're in the public, in our hospitals, we advertise the flu vaccination for all of our staff to be availed. Kasi nga, syempre, we want them to be able to be healthy, to not have the flu and be off sick from work, and to be available to look after the patients that we have. Now, I've joined the Peer Vaccinator program for the last 3 years, and I think it's important because when I started, I was in the care of the elderly, which is obviously the adult, very old gerontology wards. So they are very fragile. They are very at risk. They are the first people who gets the flu vaccination. So I thought, well, if we're looking after our patients, and say, for example, I went to work and I actually have the flu, I could be giving that to my patient as well, who's already at risk anyway. So for me, in my mind, the best thing I could do as a nurse and as a staff is to actually get into the program, give the vaccination to my staff, give the vaccination to my colleagues, and then they wouldn't contract the flu virus. And then at the end, they wouldn't give it to their patients. So I was very passionate about delivering that to my colleagues, because sometimes they're so busy, they don't have time to go to the clinic. So what I did was I said, well, okay, I'll do that. And I was walking with my trolley all over the wards, going to where my colleagues are and giving them the vaccine where they work. So that means that they are having the vaccine, they're availing the vaccine while they're at work, and they don't have to, specify a time, make an appointment, get out of their ward areas to actually go to our occupational health office. So I'm giving them those, and I was so sweaty. So when I did that 140 vaccinations in a day, my occupational health director has recognized the hard work and the passion I have for it. So for the 3 years running that I've joined the program, I was the most peer vaccinator that has had the most vaccinations. But obviously, because I have other jobs and other things that I need to be doing, I led the service to my group, and I made sure that my colleagues have had the flu vaccine. And so that's how it was recognized that I was passionate about it, and that's how they chose me to do the COVID vaccine. When they said about the COVID vaccine being the first, I didn't really think that it was going to be global, or it was going to be so big. I really just thought it was going to be something that's in the UK, that's something that, oh, you know, in the Midlands. Because I wasn't a part of the in and out of the rollout, because the government will be, you know, talking about logistics and how to roll it out. I wasn't part of that. The only one I was part of was how we were going to deliver it and roll it out in my own trust. So I didn't have the insight of how big it was going to be. Because I think maybe I was really busy and I didn't really have the time to actually digest it. And in my mind, I was just doing the job that I was meant to be doing. And because I have a lot of experience with vaccination, I was comfortable. I was, you know, I know what I was doing. I was guided by Public Health England. I was guided by World Health Organization policies in terms of the, you know, the PPE and things. So yeah, I was comfortable. Pero I never thought that it was going to be this big.
And did it feel different administering the COVID vaccine compared to just doing like a normal flu vaccine? Is there any difference?
Yes, there's a lot of difference because it's so new. The preparation as well is very new and very technical. The flu vaccine comes in a single syringe where it's already connected to a needle. So all you need to do is take the cap off and give that to your patient after your risk assessment, after your consent and everything. With the COVID vaccine, it has to be stored differently. It has to be mixed differently. It has a time pressure in it, whereas say, for example, with the vial, once you've mixed it, you can only give it for a certain amount of time. Once it's been taken out of the vial, you only have half an hour for that syringe to be given to a patient. So there's a lot of guidance and a lot of stringent measures to make sure that the vaccine is actually viable when you give it to your patients. So there's a lot of rules there in terms of the mixing, because obviously the flu vaccine is already pre-mixed. Whereas with the Pfizer one that we did, you have to mix it, you have to store it properly, you have to, there's a time limit on it. So it's and it's also very precious in terms of the amount, because obviously the production of it and the logistics of actually delivering those amount of vaccines across the UK, it's very precious. It feels like you're handling gold, liquid gold, you know? And you're thinking about the waste and you think, oh no, I cannot waste any of this. So yeah.
Yeah. Well, going back to how you administered the vaccine, or rather being the first person to administer the vaccine, I just wanted to highlight a few things. So it was your initiative, your passion, and generally just your love for your patients and colleagues that actually got you that role, right? Yeah. It's just amazing when you think about it. Here, especially here in the UK, that they don't really chose the race, but rather it's how you performed in your job, how you took the initiative, and it's all about your passion, basically.
Yes.
And now I just wanted to know, where are you right now? No, I don't mean location-wise, but how are you in terms of your success, your right now, your fame with being the first person to administer the vaccine?
For me personally, it hasn't really changed what I do from day-to-day basis. There is a lot of really kind and really generous people out there that they appreciate the fact that we're doing what we do. They appreciate the risks that we take for our patients, and there are a lot of nice people out there. But it's also opened up that kind of worm that you don't want to actually talk about, where there's a lot of people there that they don't have better things to do, really, just to criticize people for every little thing. Pero for me, the fame, or the, you know, being known as the first COVID vaccinator, I think it helps highlight the importance of the dedication and the passion that you show in your job. And I said to one of the interviews that Filipinos are normally really hardworking, and we are a compassionate race. We try and look after our relatives, our elderlies, our families. We tend to help them as much as we can. If they say, "Oh, I need help," the thing that you say is, "Yes, I will help you." You know, if someone says to you, "I need your help," we Filipinos just go, "Yeah, what can I do for you?" And I think that shows in our profession. For me, at the moment, I just there's nothing different in terms of day to day, because I still do my matron role. I still look after my staff to make sure that they are actually well and that they're, you know, looked after. Para naman, if you're looking after your staff, they can then look after your patients better. The only thing I could say is that I think there's an influence where, if this is something that I can use to spread the word in terms of our Filipino community struggling, and if they need help, this is the best kind of platform to say to them that you are not alone. You don't have to suffer in silence. You don't have to suffer on your own. There's always people listening. Being a part of the FNA UK group, I'm actually blessed, because it's someone that you're with, like-minded people that can support you in terms of your employment, in terms of your culture, in terms of any struggles that you've met. And I think there's such a good source of like a shoulder to lean on, as it were. So, pero there's really nothing different between what I was before December 8 and what I am now. And I think the only difference as well would be people expect more from you anyway. Pero now I think you have to be perfect. Not perfect, pero you know, you like following the rules, being a good role model, looking after yourself, looking after your staff and your colleagues, the resilience that you build. I think it's important as well that when we do something, or we say, you know, this is my values, is that you actually do that day to day. That's what people see in you, because the expectations are really high. Even before I was known for the COVID vaccine, I just felt that as where I am in my role, I have to be showing people how how to role model. You cannot say to someone, oh, you need to do this, but you yourself is not following that rule. You know what I mean? So it's important to role model all the time. Definitely. And the pressure.
Well, is there any final words or any advice you can give to the nurses here in the UK?
Yeah, because obviously you're a big inspiration to, you know, Filipino nurses who are currently in the Philippines. And since you've been in the UK for such a long time, and you know all the processes that every nurses go through, from coming from the Philippines all the way to being where you're at now. So what can you share, like, to the Filipino nurses who aspire to be like you someday?
So for the Filipino nurses that, you know, aspire to go to the UK or to America or everywhere else, what I would say is that stick to your values. So we have our core values as Filipinos. Stick to them. When you get to this country, make sure that you are kasi diba, we're very shy, we're very submissive, we're very mahiyain, we don't want to bother people. When you get to other countries, it's different. The culture is very, very different. And I think it would it would be a really good thing to know what the culture is of where you're going. So say, for example, some nurses go to Saudi, so the culture is very different. So they learn the values of that country. It's the same in America. It's the same in the UK. We have got different practices and values. What I would say is learn the culture, integrate the culture, because that's really important in making sure that what you show is that you're actually integrating with the country that you're in. So sometimes it's really hard to integrate. So kung ano yung ginagawa nila dito that's different from the Philippines, you'll have to adapt. Also, that comes with the premise of being assertive as well. So say, for example, you wanted to, there's something that they want you to do and you don't believe in it, or you don't agree with it, and you're just not happy to do it, you're going to be advised to say, yeah, I'm not happy to do that, I'm not doing it, and then make sure that you're actually in the right context. So when I first came here in the UK, I was versed about abortion. So ang sabi sa amin before was that if it goes against your values, if it goes against your beliefs, if it goes against your religion, your personal belief, you can say, sorry po, I can't do that. I would rather be assigned somewhere else because I don't believe in abortion, for example.
Yeah.
And you're going to be allowed to do that. Don't feel like as if you can't say it, because at the end of the day, people do respect each other's preferences and their own decisions in terms of practice. Kung hindi ka, if you don't believe in abortion, if you don't want to be involved in that case, and then say so. And that's part of being assertive. So sa Pilipinas, they would say, oh, you're not allowed to do that. You only do as you're told. Pero dito, it's different. If you're not happy about something, you are well within your rights to say, I'm not happy po. Can I be moved to somewhere else? And they will be happy and willing to actually accommodate that. Siyempre, depende yun sa what you're asking. So practicing assertiveness is different from being bossy or being demanding. There's a difference. Yeah, so work hard, show your passion, be assertive of what you want, know what you want to do. And if, say, for example, it took you 5 years to decide what you want to do, that's fine. Take your time. Everyone is different. What I would say as well is that if you need help, please do reach out. Reach out.
That's a very great
Definitely.
advice, May. Yeah. And yeah, is there anything else you'd like to share to our fellow Filipinos, not just specifically nurses, or just like in general here in the UK?
So what I would say is, in the Philippines, kasi diba dito we tell people to wear your mask, wear your PPE, don't go into groups, you have to socially distance. For the Filipinos that are in here who's had the vaccine, please make sure that you're still following guidance, that you're still following the PPE, the hand hygiene, the social distancing, the bubble, the stay at home, that if you don't need to go out, don't go out. Also, if you have any queries about the vaccine and you're not sure, I would say is read on the research, read on the proper channels and not just gossip. So try and verse yourself with the facts instead of the chismes. With our healthcare professionals everywhere, if you are struggling in terms of the PTSD that you're suffering with, or if you feel like you're having anxiety, please do seek help. Don't suffer alone. With the Filipinos back home, please follow the rules. I know that there's a lot of like I think that last week they had the Black Nazarene thing, and I've seen so many pictures of people in Divisoria, even though they have masks on, they were really clumped on together. What I would say is, please don't do that. Try and socially distance, because I know that when people say, oh, I'm all right, I've had it, but I was okay. But what about those people that you come in contact with that, unfortunately doesn't get away unscathed? So what about those people that will actually die because some people were just not saying that, oh, actually, I'm all right? Then what about those other people that we get in contact with? So we have to just be mindful and considerate of all those people that you might not know they're high risk, but what if they are high risk, and then you unintentionally give them the virus because you don't really care? So what I would say is, please follow the rules. It's not just for yourself, it's also for your family, for your neighbors, for your community, and that's across everywhere. And the only thing that I could say is that follow the rules and don't suffer in silence or suffer alone.
All right, thank you. And there you have it, mga kabayan. Thank you for watching, and thank you, May Parsons, for your time. It was a pleasure having this chat with you. And again, kami ang Kabayan Remit, ang inyong kaibigan, kapamilya, kasama sa tagumpay ang iyong kabayan. Thank you.
Thank you for having me.
Thank you.
Ingat.
Thank you.
Bye.